Coming up, doctors call it the winter blues, seasonal affective disorder. It's a serious condition and it can even happen in a beautiful place like this. We'll talk about that with Dr. Thompson coming up.
Season is supposed to be a joyful time of the year, but for some it's actually a really tough time to get through. In fact, there are a lot of folks that may be suffering from something and don't even realize it. It's called seasonal affective disorder. Ironically, the acronym spells out SAD, and it all has to do with actually our weather and how short the days are. So we decided to bring in Dr. Sharon Thompson to talk about this, particularly given the fact that women, I was surprised to hear this, are more prone than men. Good morning to you.
Yes, good morning, and thanks for dealing with this important topic.
Yeah, and I think it's important to talk about it because some folks might not even know how to identify it. So let's first start with the symptoms. What should we be looking for?
Absolutely. And one thing that is important to say is that when the days get short and it gets cold, many of us have a hard time motivating to get out of bed. This is different than that.
Okay.
SAD is a disorder related to depression. In fact, it's a type of depression, and the symptoms are more severe. Difficulty with mood, feeling sad most days or all days, having trouble with sleep, having trouble eating, not interested in things that you normally would be interested in, not having the motivation to do your daily activities, and maybe even thinking about harming yourself or others. So the symptoms are quite severe.
You know, we were talking about how folks who already suffer from depression, that actually kind of sounds like the same list, but you say this is on top of what you already may be experiencing.
And what defines SAD versus depression is the triggering of symptoms with the shortening of days. As the light becomes less and less every day, people notice that these symptoms may come on, whereas in the longer days, they're just fine.
Now, I'm curious, Dr. Thompson, in a place where we see so much sunshine, are we that much more prone when we get less sunshine?
That's an excellent point, in that we see SAD more the farther away from the equator you are. So the shorter the days get, the bigger the risk group. So folks who live here in Arizona or the places where their days stay a little bit longer, there's not as much variation, you're going to see less SAD, but definitely you'll see it here as well.
And I got to believe that the exhaustion, all the running around for the holidays doesn't help either. So let's talk about some of the treatments.
Sure. One of the biggest treatments is going to be light therapy, which is easy and available to most people. It's a special kind of light, so it's not just turning on your lights at home. Medications, just like you would for any other depression. And then all of the other things that we can do for self-care, and talk therapy can help as well. So definitely, you talked about running around and stress, so you want to deal with those added stressors and really try to resolve them. That will be helpful as well.
When I think of sunshine, I think of vitamin D. Is that something you can just take, like a vitamin?
Absolutely. Vitamin D treatment is one of the therapies along with the others, because many of us don't get out in that sunlight enough to make vitamin D from our skin, which is how our bodies would naturally make it.
You know, the other thing I want to address here, Dr. Thompson, with mental illness, a lot of folks sometimes are embarrassed to reach out, or they don't, or they're tentative about reaching out. Would you let folks know at home that you should reach out? Yes?
Absolutely. It is so important to acknowledge mental health issues and to reach out and get help. There are treatments available, and people can live fulfilling and active and happy lives if you get treatment and seek help. It is so important to seek help.
Well, Dr. Sharon Thompson, thank you for educating us this morning, and as always, really appreciate it.
Thank you for having me. Happy holidays.
We'll be right back with more Good Morning Arizona.